The forest floor has always been a pharmacy. A 2021 study published in the journal Parasitology Research confirmed that artemisinin, the active compound in Artemisia absinthium, demonstrated significant antiparasitic activity against multiple intestinal worm species in controlled trials. Medieval physicians across Europe documented these same 5 plants as the foundation of antiparasitic treatment for over 8 centuries, long before synthetic drugs existed. Yet, today, a single prescription antiparasitic pill costs upward of $200, while the plants that inspired its chemistry grow freely in disturbed fields and backyard soil. These are not folk superstitions. These are documented botanical realities, tested by history and increasingly validated by modern science. 5 herbs, 5 centuries of use, 0 pharmaceutical patents. Each one dismissed, suppressed, or simply forgotten as industrial medicine replaced the hedgerow with the factory. The names are not exotic. Wormwood, milk thistle, cloves, black walnut, tansy. They grow wild across temperate regions of the world. But the knowledge of what they once represented has been quietly buried. And the most unsettling fact in this story is not what these plants contain, it is who decided you should stop knowing about them. Artemisia absinthium has one of the longest documented medicinal histories of any European plant. Roman legions carried dried wormwood bundles on campaign to treat dysentery and intestinal infections in the field. The plant's bitter compound, absinthin, triggers bile production and creates a hostile gut environment for parasitic organisms. Egyptian medical papyri dating to 1550 BCE, known as the Ebers Papyrus, recorded wormwood preparations as treatments for intestinal worms. That is nearly 3,500 years of continuous documentation. The industrial era dismissed it as a liability. Absinthe, the liqueur distilled from wormwood, was banned across Europe in the early 20th century, and the plant's entire reputation collapsed along with it. The ban was largely driven by moral panic, not pharmacological evidence. Modern toxicology confirms that thujone, the compound blamed for absinthe's supposed madness, is only dangerous in concentrations far beyond culinary or botanical exposure. Yet the stigma remained, and the plant retreated from common knowledge. Wormwood still colonizes roadsides, wasteland, and dry hillsides across North America and Europe. It grows where nothing else will. The bitterness that makes it powerful also makes it impossible to commercialize. That inconvenience, not toxicity, ended its mainstream history. Silybum marianum grows as a weed across the Mediterranean, the American Southwest, and disturbed ground on every inhabited continent. Most gardeners pull it up without a second thought. The plant contains silymarin, a flavonoid complex studied in over 200 peer-reviewed trials for its hepatoprotective properties. Ancient Greek physician Dioscorides described milk thistle as a remedy for liver and gallbladder complaints in the 1st century CE. That recommendation held for nearly 2,000 years. The liver is the body's primary detoxification organ, and parasitic infections routinely compromise it. Milk thistle's documented role was not simply cosmetic. Medieval herbalists categorized it specifically alongside antiparasitic protocols, not merely as a digestive bitter. Today, silymarin extracts are sold in capsule form at significant cost in every health food chain. The plant they are extracted from grows freely in vacant lots and field margins. This gap between free abundance and expensive supplement is not accidental. It is the defining economic logic of modern wellness culture. The plant refuses to disappear, no matter how thoroughly the market pretends it doesn't exist. Syzygium aromaticum, the clove tree, once commanded a price equal to gold by weight in medieval European markets. Entire naval empires were built on controlling its supply routes from the Maluku Islands of Indonesia. The active compound eugenol, concentrated in the flower bud, has demonstrated broad-spectrum antimicrobial and antiparasitic properties in laboratory settings. A 2011 study in the journal Phytotherapy Research found eugenol effective against multiple parasitic species at concentrations achievable through botanical exposure. Traditional Ayurvedic medicine documented cloves as a core component of antiparasitic formulas for over 1,500 years. The spice trade made cloves expensive precisely because they worked. Demand was not driven by flavor alone. Merchants and physicians both understood the plant's protective value. Today, cloves cost almost nothing at any grocery store. The knowledge of their historical medical application has been almost completely separated from their commercial presence. They sit in spice racks, stripped of context. Eugenol itself is now synthesized in pharmaceutical labs for dental anesthetics and antiseptic formulations. The living tree that produces it naturally is considered irrelevant to modern medicine. The molecule was extracted. The plant was abandoned. Euglans nigra, the black walnut, produces one of the most chemically complex hulls in the plant kingdom. The green outer hull, not the nut itself, contains juglone, a compound with documented allelopathic and antimicrobial properties. Indigenous nations across eastern North America used black walnut hull preparations for centuries to address intestinal parasites, recording this knowledge through oral tradition and later through early ethnobotanical surveys. 19th-century American eclectic physicians, a school of medicine that combined botanical and conventional treatments, formally documented black walnut as an antiparasitic agent in their clinical records. Juglone was later found to disrupt the energy metabolism of certain parasitic organisms in vitro. The hull also contains tannins at concentrations high enough to create an inhospitable environment for soft-bodied intestinal parasites. Modern pharmaceutical research has not pursued juglone as a drug candidate. The reason is structural. Juglone cannot be patented in its natural form. No patent means no return on investment. No return means no clinical trials at scale. And so, a compound with centuries of ethnobotanical documentation remains outside the mainstream pharmacopoeia. Black walnut trees still drop their hulls every autumn across the eastern United States. The ground beneath them turns black with juglone. The knowledge of what that stain once meant has nearly vanished. Tanacetum vulgare is the most complicated plant on this list, and the most important to approach with historical precision rather than enthusiasm. Tansy contains toxic thujone and other compounds that can cause liver damage, seizures, and death. It is not for internal consumption under any circumstances. Yet its historical record as an antiparasitic agent is extraordinary and spans virtually every major herbal tradition in Europe. Medieval monasteries cultivated tansy specifically for external pest control and for inclusion in burial preparations. Its volatile oils are powerfully insecticidal. The Lacnunga, an Anglo-Saxon medical manuscript from the 10th century, documented tansy preparations used historically against intestinal worms, a practice that persisted in rural European communities into the 19th century. Its disappearance from practical use was not suppression. It was a necessary reckoning with genuine toxicity. Modern toxicology confirms thujone accumulates dangerously with repeated exposure. But tansy's botanical story is not about consumption. It is about the complexity of the plant world. The fact that chemical power and chemical danger often occupy the same leaf. Tansy grows freely across North America and Europe, naturalizing wherever it establishes. As a companion plant, its insecticidal volatiles deter aphids, ants, and certain beetles from surrounding crops. That ecological role, entirely external, entirely safe, represents tansy's legitimate place in the modern garden. The history is worth knowing. The caution is non-negotiable. The shift from botanical to pharmaceutical medicine did not happen because plants stopped working. It happened because plants could not be owned. The patent system that drives modern pharmaceutical development requires a molecule that can be isolated, synthesized, and legally controlled. A plant growing in a field cannot be patented. Its active compounds can be extracted, modified, and repackaged. But the plant itself remains free. This structural incompatibility between botanical medicine and industrial capitalism is the economic engine behind 5 centuries of suppression. The word weed is a category invented by agriculture, not by botany. Dandelion is a weed, so is wormwood, so is milk thistle. None of them received that designation because they lacked value. They received it because their value could not be captured by a corporation. Every suburban lawn treated with herbicide is a pharmacy being quietly demolished. The plants grow back regardless. Biology does not recognize property rights. The soil remembers what the market has tried to forget. None of these 5 plants require extraordinary skill to cultivate. Wormwood and Tansy are perennials. Plant them once, and they return every spring. Milk thistle self-seeds aggressively. A single plant can establish a colony within 2 seasons. Black walnut grows across most of the temperate United States and requires nothing from the gardener except patience. Cloves demand a tropical climate. But dried clove buds from any kitchen represent the same botanical chemistry that empires once fought to control. The act of growing these plants is not a medical decision. It is a historical one. It is the recovery of a relationship between human beings and the plant world that predates pharmaceutical industry by millennia. Every hedge, every disturbed field, every untreated garden corner is a potential archive of this knowledge. The information in that archive is not dangerous. It is simply inconvenient for those who profit from ignorance. Grow the hedgerow back. Reclaim the vocabulary of the soil.